Welcome to our podcast, voted one of the best in the marketing research industry in both 2019 and 2020, and this year named by FeedSpot as one of the top places to go on YouTube for market research information. This is Research Business Daily Report. We're seen every week with the only video look at research news that's important in our industry. We do rely on viewer support. We hope you'll pitch in, and we'll tell you how you can do that at the end of today's report. I'm Bob Lederer in my 27th year as the respected voice in market research and recently honored for a second consecutive year with SMR's Insight 250 Award. The pharmaceutical and healthcare industries are traditionally slow adopters of new research tools and techniques. One longtime pharma research executive long ago and famously told me that the pharma industry can be as much as 5 years behind all other business categories when it comes to adoption of innovations, technological and otherwise, for research. However, there is one important exception that has taken place in the last decade, and that's in social media. In fact, pharma actually more quickly adopted social media as a completely novel information tool than most other industries. Rajesh Kari, who's the VP and business leader of InfoVision Social, blogged recently about social media opening dimensions of insights for pharmaceutical companies that were not there before because social media conversations happen to be a continuous source of prevalent, precise, real-world intelligence. Social media's exploratory input encompasses ways of monitoring patients and HCPs' changing needs with respect to treatments, drugs, and therapeutic segment developments. Ask the therapeutic leaders in the industry and they will maintain to you that social media validates decisions concerning patient challenges, clinical intervention opportunities, and even building illness-specific landscape studies that can focus on drug launch strategies, treatments, drug therapies, and pricing strategies. Continuing on today's RBDR trek into this area, social media is especially adept at finding patient populations in rare disease areas, including advocacy groups. Social media has been proven to offer competitive intelligence, uncovering current initiatives, KOLs in therapeutic areas, and caregiver experiences. Brand equity is yet another dimensional social media deliverable, providing uninhibited views and perceptions of any brand, including brand health, plus building new brand perceptions through improved strategic brand planning. In the vein of hot new research areas, social media offers a glimpse of patient journeys and even delves into experiences of caregivers. Social media can present a clear picture of symptoms, treatments, side effects, and effectiveness of medications and mortality. And research isn't the only benefactor of social media insights. Consider that community-level insights from social media can be leveraged by R&D, clinical trials, and drug development. About the only caution about use of social media when it comes to pharmaceutical and healthcare matters is to not rely entirely on this admittedly meaty material. Social media is without a doubt a pharma information mainstay, but it should be complemented, say experts, by human-powered analytics. That's a wrap on this Research Business Daily Report. As we mentioned at the start of today's video, we'd encourage you to become an RBDR Patreon supporter, which means an individual or company that agrees to provide a monthly contribution to us via credit card, perhaps $5 for an individual per month, or $25 or more from a business to help us defray costs and maintain the excellence of our reporting. If that is something that you might be inclined to do, please visit our exclusive crowdfunding platform at patreon.com/RBDR, where you can select the level of support that you're comfortable with and that you think we are deserving of. Whatever that may turn out to be, we say thank you in advance. We hope you have a good research day. We'll be back here next week with another report, and until then, please Stay safe.